Hello, my name is Wayne Kelley. I'm a spine surgeon here at OrthoGeorgia. Today I'm going to talk to you about lumbar spinal stenosis. Lumbar spinal stenosis is a condition where you have compression of the nerves in the lumbar spine that cause pain down your legs. Typically this pain is going to be pain that's worse with standing and walking and better when you sit down or bend forward. It tends to be a dull, achy pain down the legs with heaviness in the legs. The reason you get this is because you have compression of the nerves in the lumbar spine. First of all, we'll talk about the lumbar spine. We've got 5 lumbar vertebrae, numbered 1 through L5. There's always a vertebral body, the disc in between. You have the posterior part, you have a spinous process, and right here is a neuroforamen, and this is where the nerve exits. Typically when you have spinal stenosis, it's going to be a midline central disc herniation, or most of the time it's from a degenerative process. The degenerative process being our discs shrink as we age. As the discs shrink, it causes compression of the nerves in the posterior part of the dura. The first way to evaluate this is to have a physical exam by your spine surgeon. They will test your sensation, your neurological function, and get a history of how long the problem's been going on. With that, we usually also take a series of x-rays of the lumbar spine. That way we can see what the bony structure is, and also to see if there's any slippage. Sometimes you can have where one bone slips forward on the other bone, and that's called a spondylolisthesis. That just shows us there's increased arthritis with a little bit of instability in the spine. Our first line of treatment for this is going to be anti-inflammatories, physical therapy, perhaps a lumbar back brace. And again, most people can live with spinal stenosis, but there are times when spinal stenosis causes significant complaints or disability where people cannot stand and walk as long and they want to be more active. Most of the time people can live with spinal stenosis, but again, when it starts affecting their activities of daily living and they want to be more active but they can't, those are times we start considering surgery. Surgery for spinal stenosis could be as simple as a small laminectomy, a small procedure, or as big as a fusion if needed. It depends on how much compression there is, how much of a decompression you need to do, and if there's any instability in the spine. If you're experiencing any of these symptoms with pain radiating down your legs, numbness and tingling or heaviness, then please come see us here at OrthoGeorgia so we can diagnose your problem.